Back to life, back to reality. Vacation is officially over, and I have my first doctor's appointment with Dr. D. It's to check up on the surgery. This part is reconstruction, and I want to know the details now. I don't know exactly what's going to go on, so it's time to ask him all the questions about how he's going to put back my breast. So I'll give you guys the details after. Hey guys, so I just got back from the hospital. By the way, it's Tuesday, January 28th, and I was scheduled to meet Dr. Dianasopoulos, who is my plastic surgeon, and then also to do a bunch of pre-op tests before surgery. So here's what's new. Basically, my surgery was scheduled for February 6th, but it got bumped to February 13th. I had no idea. There was like whiteout on the paper, like removing February 6th and changing it to the 13th. Found that out today. I'm guessing it was because of doctor's schedule clashing, but I'm meeting Buelo tomorrow, the 29th, and I'm going to ask him what happened. But it's just a week postponed, so it's not that bad. However, that means I'll be in the hospital for Valentine's Day because I have to stay overnight. So please think of me and not just your lovers on V-Day, because I will be pretty much lying in bed drugged up at the hospital with a new boob, because I like to see the positive things in life, right? I always say there is always the good in the bad. It's just a matter of seeing it. And something else that's new is that I found out that I'm officially going to be going from a B cup to a C cup. That's right. Apparently, I asked whether or not my breasts are going to be symmetrical. And in order for them to look the same, because my left breast is going to be completely removed, and then a tissue expander is going to expand the skin to then place a silicone implant, it has to match my right breast. So he said that he's going to add a small implant in my right breast. So that means I'm going from a B to a C. That's cool, eh? New boobs on Valentine's Day. I could deal with that. That's not a problem. Otherwise, I did a bunch of pre-op tests. It was a long day to go to a blood test. I had a friggin' Q-tip type of swab swiped in my nose to see whether or not I'm going to be allergic to any of the medicines. I met another doctor, I met another nurse, and it's just all these tests to see whether or not my body is strong enough to go through surgery, to go through the operation, whether or not I'm going to be allergic to the medicine, or if my body's strong enough to handle the anesthesia, because I will be put to sleep. And so, yep, that's about it. And then, oh yeah, I had so many questions because I'm just trying to figure out when this journey will be over. I want to know, when is it that I can just live my life and travel to Thailand and not worry about, having to come back to the hospital and do all these appointments. So I asked questions such as, what does my schedule look like post-surgery? And apparently after my mastectomy / immediate reconstruction, I'm going to come back, and every 2 to 3 weeks he has to inject my expander with saline, which is it's like a balloon, right? And then we're expanding it so that it creates a pocket in my breast. And then I asked when will be the second phase of the reconstruction, which means to actually, insert the implant. And he said that if I don't have to do radiation, which is not sure yet whether or not I do or not. So if I don't, then May I have my second phase, which is the aesthetic, creating, fixing the breast and making it look aesthetically nice, and inserting my silicone implant will be in May. And if I have to do radiation, then we gotta wait, and it'll be after summer. So yes, those are my days to come. I will keep you posted on my mastectomy tomorrow.